Hello everyone and welcome back to MediInsights. Today we're exploring Amisulpride Tablet, what it treats, how it works, how it's dosed, possible side effects, and key safety tips so you and your loved ones can use it safely and confidently. Stay tuned for clear, evidence-based guidance from trusted sources. Starting with use of Amisulpride Tablet. Amisulpride is an atypical antipsychotic mainly used to treat acute and chronic schizophrenic disorders, particularly when positive symptoms like delusions or hallucinations are present. It can also be used to help negative symptoms in some patients, and in some countries, low doses are used for depressive symptoms linked to low motivation. Your doctor will prescribe it only after assessing your symptoms and history because antipsychotics need individual tailoring. Next, dosage of Amisulpride Tablet. Typical starting and effective doses for acute psychosis are usually in the 400 to 800 mg per day range, given in divided doses, and doses may be adjusted by the prescriber up to 1,200 mg in exceptional cases. For lower dose indications, the amounts are much smaller, and the exact tablet strength and schedule should always come from your prescriber. Do not change dose or stop the medicine suddenly without talking to your doctor, because symptoms or side effects may change. Next, mechanism of action of Amisulpride Tablet. Amisulpride works mainly at dopamine D2 and D3 receptors. At low doses, it preferentially blocks presynaptic autoreceptors, which can increase dopamine release, while at higher doses, it blocks postsynaptic receptors in limbic brain areas to reduce psychotic symptoms. This dose-dependent dual action helps explain why different doses can have different clinical effects. Next, side effects of Amisulpride Tablet. Common problems include drowsiness, weight gain, and movement disorders such as tremor or stiffness in some people. Amisulpride more frequently raises prolactin, which can cause breast changes, menstrual disturbances, sexual dysfunction, or galactorrhea, so report any such symptoms to your clinician. There is also a risk of QT prolongation and other cardiac effects, particularly at high doses or with other QT prolonging drugs, so ECG monitoring may be needed in some patients. If you notice fainting, irregular heartbeat, severe muscle stiffness, high fever, or uncontrollable shaking, seek medical help immediately. Next, important advices for using Amisulpride Tablet. Tell your doctor about any heart problems, low potassium, slow heart rhythm, or other medicines that affect the QT interval before you start Amisulpride. Because Amisulpride is mainly cleared by the kidneys, your doctor may reduce the dose if you have reduced kidney function, and it is not recommended in severe renal failure without specialist advice. Avoid alcohol while taking it, be cautious driving until you know how it affects you, and do not use it in pregnancy or breastfeeding unless a specialist advises it. Always report side effects, keep follow-up appointments for blood tests or ECGs if requested, and contact your prescriber before stopping the drug. Thanks for watching. If this helped, please subscribe to MediInsights and leave a comment with questions or experiences. Your feedback shapes future videos. We'll answer comments promptly. Stay safe, take your medicines as prescribed, and consult your doctor for advice.